everyone. It's Mia Jackson. And again, this is Me Week 19. And we are here today with a very special guest. She is a doctor at Stanford University still. Of course she is, right? You know, everybody is from Stanford right now. We are focused on our chocolate cardinal community. And the topic tonight is when it hits home. This is something serious, but fortunately, we have, again, a plethora of resources in our community. I'm going to let her introduce herself because I want her to make sure she gets all those pertinent details in. And here we go. Leah, take it off.
All right. Thanks, Mia. This is, I just want to put a plug in and say that I think this is fantastic, what you and Tanya are doing and galvanizing the community to come together and pool our resources to do something which I hope will be really meaningful and helpful. So by way of introduction, I'm Leah Backhus. Used to be Leah Fuller, class of 95 at Stanford. I am currently an associate professor in the School of Medicine at Stanford in the Department of Cardiothoracic Surgery. I am a thoracic surgeon. So I'm actually board certified in two specialties. One is general surgery by American Board of Surgery and cardiothoracic surgery by the American Board of Thoracic Surgery. My current clinical practice, being at Stanford, it's a teaching institution, obviously, so I teach a lot of medical students and residents and even some undergrads, and make my way back over to the undergrad side of campus to spread the love, if you will. But clinically, I actually split my time between Stanford and the VA, and cardiothoracic is an interesting specialty because there's the cardio and there's the thoracic side, and if you're in an academic setting, you pick one of the two. I've chosen thoracic, so I don't operate on the heart anymore, but I, well, not intentionally anyway, but I do operate on the lungs. And of course, have a pretty detailed understanding of the way in which the heart and lungs both work together.
And on a personal note, Dr. Leah was quite helpful for me and my family. My sister had a lung issue recently, and the first person I thought of was Dr. Leah. I said, I need to know what's really going on, so I need to send you to somebody that I trust and that I know. So I sent her right up there. And of course, you know, it makes a difference when you can talk to the person who is in charge, and she could just send you a text and say, yeah, Mia, here's what's happening, you know, because we don't normally have that relationship, I think, with doctors, or you can just get that text. And then also there's just a security factor of knowing that the person cares for your people in general. I mean, and not just on the doctor care level, basically. So thank you, Dr. Leah, for making that possible.
Of course.
For us.
Anytime.
So yeah, but so getting that out of the way, and wanted to bring her on because, as you all know, Me Week is in honor of Magnus Christen and Eric Jackson, both of whom we lost, you know, again, way too early for us. And we lost them both very suddenly to heart issues. And given her background, we wanted her to talk a little bit more about some signs and things that we can do to make sure that we are paying attention to any clues or anything that we can possibly, you know, really, I guess, figure out early so that we don't have to deal with this in the way that we had to deal with this with Magnus and Eric. So with that, Leah, you know, tell us a little bit more about what can happen with heart disease and why it's, you know, so surprisingly, I guess it's definitely something that's, you know, fatal for our community, for sure.
Yeah, I mean, I think we need to probably reframe things a little bit to speak slightly more broadly and talk about cardiovascular disease and cardiovascular health, because it's more than just the heart. It's the heart and all of its blood vessels and all the things that can kind of go wrong with that. And I mean, I think that you know, always the best defense is a strong offense, honestly. Like you gotta arm yourself first with the knowledge of the real threat. it is a real threat. And we've got to be proactive to make sure that we manage that threat appropriately. It would be delusional to think that, oh, because you are in a certain socioeconomic class or you have this particular background, that you are that otherwise negates the fact that you're still at a higher risk of developing issues with cardiovascular diseases just by virtue of being an African American here in this country, right? Like, we don't like to think that, right? We like to think that there's this independence that we can kind of overcome any and all. But that's, as I said, really delusional. The fact remains that on balance, we are at way higher risk of developing issues with our cardiovascular system. And those would include heart attack, heart valve problems, stroke, and all of the other conditions that come as a package that predispose us to those conditions, those end conditions, if you will. So those would include hypertension, diabetes, and hypercholesterolemia. So I think if you try to think more broadly and think, how many people do I know who have had a heart attack, who are on high blood pressure medication, who have diabetes, who are overweight, who've had a stroke or a mini stroke? That number is probably pretty astronomical for the majority of us. But instead, we take a little bit more myopic and protective view to say that, oh, heart disease is just like people who had a heart attack, right? And that's not the case. It also includes heart failure, just sort of non-ischemic heart failure. So, and if you have these other conditions like diabetes and hypertension, then you're going to be a lot more prone to developing heart failure just in and of itself, whether or not you had a true heart attack or not. You may have even had a heart attack and not even know it. That's another thing. So, I think that we've got to be proactive about opening our eyes and not being afraid to face our fears of what there is out there. The other thing that I would say is that people need to be, I say people, and I'm not excluding myself from the group, of course, but, we have to reframe our relationship with our physicians, with our providers, the people that we go to seek care. It is infinitely better to practice preventative medicine and make sure that we can try to avoid some of these really bad consequences than it is to deal with the consequences once they've happened. They never happen out of the blue, or almost never, right? So it's not like you just had a heart attack, had zero indication prior, had no one ever tell you that you should quit smoking or that you need to lose weight, or you know what I mean? Like, that doesn't happen. There's always some precursor. There's always something there.
I think it is, right? Yeah, just out of the blue.
I was just doing, just minding my own business, living my life, and then out of nowhere,
doing me today,
bam, got this heart attack. And like, really? Because it doesn't usually happen that way. I mean, I'm not saying you never can say never, right? But for the most part, we do have a ample amount of knowledge to know what habits are bad that we otherwise still do in the face of that knowledge, right? And then there, as you and I were speaking earlier, often there are other signs and symptoms that we've ignored because we know what they mean, but we don't want to have it confirmed because then we would have to deal with it. But if you view your relationship with your provider as an adversary, as someone who's going to help you to navigate this gauntlet, if you will, of healthcare to arrive at the interventions that are going to be the most impactful, the most meaningful for you in improving your health, then it's not adversarial, it's not punitive, like, oh, damn it, I got to go and see the doctor because of X, Y, and Z. It shouldn't be I got to go. It should be I'm going to go and we're going to strategize to make my health better. And I'm not trying to paint it all with, or look at it all with rose-colored glasses, right? Like, not all providers are the same. I totally get that. But if you have a provider well, first get one, right? There's that.
Yeah. Right. Mm-hmm.
And you get one and you feel like this cat doesn't know what he's talking about. Or I hate to go see him. He's always talking about this. Or, like if everything you have to say about your interactions and with that provider are negative, that means you need a new one. You need another one.
Okay.
You need to keep searching and
Can break
be
up.
like, you need to break up. Like, this relationship is not good for me. For whatever reason, right? It doesn't matter. Like, you don't have to feel guilty because for whatever reason you don't like connect with this person, or you don't feel that they connect with you and have your best interest at heart. You need to find somebody new. Because you have to have the comfort to be able to disclose any and everything to this person and feel safe and feel confident that they truly have your best interest at heart. And if you can't do that, then that's not a good relationship.
Exactly. Now, you touched upon a couple of things there that I want to
And
go
I was
back
all
to.
over the map, sorry.
No. This is great. I mean, because that's what we want this to be a bit broad, because again, it's just 1 week, and we really want this to prompt conversations for people and to just at least get them thinking about these issues. 1 week, because we're all putting these things aside, deferring them, deflecting. And as you said, we'll get that tingle, or we'll see something, or we'll somebody will say you have high blood pressure, and then you go, oh, it's not really that bad.
Well, how
Oh,
high is it?
Yeah,
It's just a
exactly.
little high.
Is it really that high? Or, can I just tackle that with
Right.
diet and I'll be okay? Is that really going to do anything?
As soon as I lose that 20
and
pounds.
So,
mm-hmm.
Exactly. And then, once I do that, I'll be fine, right?
Right.
So, okay. So, when you get those tingles and those feelings, and then all of a sudden you just try to ignore them like they didn't really happen, or you think, I'm not going to worry about that, it's not a big deal, or you just attribute it to, I'm getting older, I'm not 20 anymore, it's going to go away. How do we make sure that we say no? Or, at what point do we say, what, that's not normal, I really do need to go to the doctor, or I do need to bring this up?
Right.
That's
yeah, I mean, there are specific warning signs, right? There's sort of a specific set of things that, like, if you experience these, you must go, kind of thing, right? Like, so the typical pain of a heart attack is chest pressure. A lot of people think that it's going to be this like intense stabbing pain to the chest, and it's usually not. Actually, it's pressure. And in medical school, they teach us it feels like an elephant is sitting on my chest. So more than sharp pain, it's pressure. You can't get a good breath in, and it's this crushing pressure. It's not like a stabbing pain. And it may be intermittent. You may have been experiencing it for some time, and then now it's getting to be a little bit more frequent. It's often relieved by resting. The pain often radiates, and stereotypically we say the pain radiates down your left arm, but that's not the only place it may radiate to. It may radiate to your back. It may radiate to your jaw. Shortness of breath is another symptom. Again, it's going to be potentially relieved by resting. It may or may not be exertional, though. You may not be doing anything at the time in particular. What else? Those are the main ones. The other thing to point out, though, is particularly for females, we tend to not present with the classic symptoms. Oftentimes, females will present with what they term as heartburn. And that is a problem for a few reasons. One, because the person themselves have not attributed to their heart, which is the more big pressing issue. But two, if you do present to the emergency room, that immediately will potentially trigger going down a whole different pathway, treating you for that as opposed to treating you for a heart attack. And we know from research studies that women presenting, particularly African American women presenting to the emergency room with typical and atypical symptoms, are less likely, much less likely, to have those symptoms attributed to their heart and have a full cardiac workup done. So that's tragic, honestly. That may happen a few times. Well, the other thing is if you have a valve problem, then the shortness of breath is probably a big one, where you just have this insane fatigue that you've never felt before with pretty minimal exertion. And so there's some shortness of breath there, but more importantly, there's this fatigue factor. And that can be indicative of a problem with one of your valves. Palpitations is another one. So you feel like your heart is racing when you're really not doing anything that should otherwise cause it to be racing. That's another thing that needs to get checked out straight away. As far as stroke goes, the things you want to look for are any neurologic symptoms, right? So one of the big ones is changes in your vision. You may actually kind of lose your vision briefly in one eye. And that's a very classic presentation that people will have, and often that winds up getting chalked up to a mini stroke. You may have double vision, an extreme headache where you've never had one before, and lightheadedness where you pass out. You may also be confused. And that may not be something that you have enough insight or wherewithal to pick up yourself, but others around you may pick up and say, for like 5 minutes, you were like completely checked out, and you're like, really? That would be something to be super concerned about. Or word finding difficulty is another one.
Also talked to Ron Berry about when it hits home. And I know that you also worked with him. Can you tell us a little bit about some things in his particular case, not his particular case, or basically a case like his stroke that we may want to pay attention to going forward for us?
So I did speak with Ron and with others in our Chocolate Cardinal community when he experienced his stroke. And certainly, I don't have all the details, and I'm sure he's going to share the details that he himself is comfortable with sharing. I guess the thing that struck me most was how amazing our community was in rallying behind him and garnering additional support. But I guess the other thing that I would point out is the fact that there's no way for you to estimate the impact of a major event like this and of the impact that it's going to have on your life. It is way more than just hitting the reset button. And if you are fortunate enough so that it didn't take your life, whatever the event was, whether it was a stroke or a heart attack or what have you, I don't think there's any way that you could ever overestimate how profound of an impact it can have, and which will point to all the holes that we have in our preparedness package to deal with these things that really are not foreseeable. Or they are foreseeable, but it's just that we don't foresee them, right? We ourselves, because it's pretty profound.
Like you said, you don't just press the reset button. It does change everything, and it shifts everything about your life. You go from from being completely independent to not being able to drive, and it doesn't go away. It's persistent, it's nagging. Even if you think, okay, you know what, I think I'm okay, but you have to talk yourself. The anxiety that accompanies it, all of those things become a part of it.
Yeah, absolutely. And you realize how razor thin of an edge that we, what a delicate balance that we've managed to get everything in our lives situated with. And then something comes and just knocks it all down. And you're like, where are the pieces, and what pieces need to be salvaged? Which ones can be salvaged? changing your whole, and I think perhaps Ron will speak to this, but when I saw him at the summit, one of the things that struck me the most too was the fact that it was really frustrating for him, especially if it's your brain that's been affected. But even if it isn't your brain, let's say you fancied yourself an amazing athlete. Now you've been struck down by an aortic valve issue or a coronary event. How do you reinvent yourself if you can't immediately get up and resume all the prior activities that you were doing? And if you pride yourself on being an amazing chocolate cardinal intellectual, and all of a sudden you have difficulty finding the right words to just have a basic conversation, I mean, that's got to be pretty devastating. I can only imagine what that must feel like to the individual. And now all of a sudden you're fallible.
Exactly. And all of those things that you thought made you who you were,
right?
Now they're being tested. So
yeah,
it can be quite a bit. It can be quite a bit. Well, this is a lot to take in, but I hope that people do understand that the goal of this is to get people to think about how serious it is that they take those little twinges seriously. That they don't ignore them, that we don't ignore the hints, basically.
right. You have to be kind to yourself. I tell this to residents and medical students and whatnot, like trainees all the time, like, take a moment to be your own best friend, your own best advocate. And if your friend came to you and told you the things that you should be telling another person, what would you say? You'd be like, what are you doing? Come on. I mean, that's like a no-brainer. I mean, like, it's very obvious when it's not you, so take a moment to step outside yourself, be kind to yourself, be a good advocate, because honestly, you're the best person for the job, right? I mean, but I also want to make sure that we don't like end this all with gloom and doom and your heart's gonna explode and bad things are gonna happen. I mean,
exactly.
We're all prone to all these bad things. It's just inevitable. Like, no, I mean, I think that we need to be proactive and positive. There are lots of things that we can do to mitigate our risks. One of which, a small portion of which, is early detection of symptoms when they present themselves, right? But if you back the clock up even further, you got to try to avoid those symptoms from even occurring. And the way that we do that, all of us knows it. Like, I've never met a person who smokes, and I see tons of smokers, right, with people with lung cancer. I've never met a person who smokes nowadays who doesn't know that they shouldn't smoke. Right. I mean, it's not for lack of knowing that smoking is bad for you, right? People know this. This is a common thing, right? So the issue is that they just have been unable to quit, right? And if you could make a person quit smoking, that's the most impactful thing that you could do for that person, that individual, to mitigate their risks down the road for the things that they may wind up developing. I mean, smoking is just one, and it's something that's affects so many and is associated with so many conditions that would be incredibly impactful. But that's just one. Like, I'm sure the prevalence of smoking in our community is actually pretty small, but we still have increased risks for various things. And family history, I mean, you might look at your family tree and you got your 23andMe results and they were not uplifting. So, like, what are you going to do? I mean, hell, if you know that everybody in your family gets diabetes, damn it, you better be all over that. I mean, there are things that you can do. Cut the sugar out of the coffee, cut the creamer down, check your hemoglobin A1C. There are many medications nowadays that one can be on that aren't true diabetic medications, but that otherwise can delay the onset of developing full-blown diabetes, So, and it's impossible for a layperson to know all of the things that are out there. That's not really your job. Your job is to be a good advocate for yourself and to find a good health partner. So if you find a good health partner as your provider, it's their job to say, hey, there's a new study that came out that shows action. Like, oh, well, I'll be darned. That sounds awesome. Why don't I try some of that? Whatever, right? Or, hey, listen, I'm super not into medication. What are the things that I can do outside of medication that are going to truly help me and be the most impactful for me. If you are a skinny string bean person, weight loss is not your thing, right? But yet and still you've got this huge family history of diabetes. Well, you're gonna develop diabetes not because you're overweight. You're gonna develop it because you have this genetic predisposition. And nonetheless, you need to do some serious diet modification to work on that. Not diet modification necessarily with the goal of losing weight, but specifically for diabetes. And that's just one example. But I mean, there are a lot of things that we can be doing, and there's no one size fits all. That's why you got to have a good partner, a good advocate who knows you through and through, and you don't hold back. You spill your guts. They know everything about you, and they're going to help you to come up with a better game plan for yourself, because you can't do it by yourself. Like, we're all smart people. Hell, I'm a smart person, but I have a doctor on my team who helps me. There's no way you're going to possibly be able to know all the stuff that you need to know. When I go see my doctor, I am not a doctor. I'm a patient. I'm not a primary care provider. I don't know all the latest diabetes medications, this, that, and the other. That's not really my job to know that. That's why I have a doctor whose job it is to know those things, right? But we work together to try to come up with the best game plan. I think that's sort of the parting message that we should leave people with, is that it's not all gloom and doom. We just got to do better. We got to be better stewards of our own health and of our lives. And I think the one size doesn't fit all approach is important, because you can go out and go on Amazon and pull up a whole bunch of books about this, that, and the other, and all the stuff that you should be doing, right? And that's like for everybody. But you're like, I love sunflower seeds, which have a ton of salt.
Yeah.
So
Exactly.
whatever modification I'm going to make, it has to include my sunflower seeds, because I'm super addicted to those. And like, make it make sense. That's one of my little guilty pleasures. So then that has to stay, and I need to kind of work around that. Everybody has things that are just their thing, right? That makes them happy. That's an indulgence.
Makes them who they are, right? Hopefully that is a positive parting message, everyone. And we definitely want to thank Dr. Backhus for joining us today. Leah, you have been a gift. You've been a personal gift, and you're definitely a gift to the Stanford family. I wouldn't trade you for the world, my dear.
Oh, it's my
So,
pleasure. I'm so excited to be included. And again, kudos to you, man. This is fantastic work, Mia. I could never do something like this, so I'm super impressed.
yeah, well, thank you. We just want to make sure that, as to your point, that Me Week is really just the launch, so that we could take the control that we do have over our health, over our lives, and make sure that we live healthy, happy, and full lives to the best of our ability. That's the goal. And if anybody asks you what you're doing this week, let them know just doing me, so you can put everything else on the back burner. All righty. Thank you all
Absolutely.
for joining us, and stay here for the rest of Me Week. We will have our conference call on Wednesday, and we'll tell you more about the rest of the week then, and we will see you later. Good night.
Bye.